the number one fear people have is speaking in public. It's the one fear I don't have. Join me for the Love Speaks series, where we leave fear behind and we speak love. Loving our story, loving speaking, doing what we love, loving each other, and loving ourselves. Our stories are what connect us and make us better humans. So join me and my Love Speaks friends for some stories, some laughs, some inspiration, some speaker tips, and some unexpected truth. It's the Love Speaks series, where a little bit of love goes a long way.
Welcome to the Love Speaks series. Here's your host, Sally Lou Loveman.
I'm so glad to be here today. We're recording this podcast in September, so a lot will change when this airs because, as we all know, things change daily, hourly. By the minute, exactly. That is my friend, Dr. Renee Matthews, who is joining me by phone from Detroit because she's up there with her family, which we're going to get to. But I'm just going to say this. We are here today on the Love Speaks series podcast to discuss the health inequities in the Black community. And Dr. Renee is a doctor. She is a professional health educator, influencer, and host of the Ask Dr. Renee show. The CDC says that the death rates among Black and Hispanic Latino people are much higher than for white people. As we know, 1 in 3 Black Americans know someone who has died of COVID-19. The death toll is rising. So I invited my friend, Dr. Renee Matthews, to speak about these inequities in the Black community that the Black community faces, I should say, with COVID, and what can be done and what is being done and what we can all do. So please help me welcome from my one of my favorite cities, Detroit. I love Detroit. My friend, Renee Matthews. Hey, Renee.
Hi.
Hey, how are you?
I'm good. Thank you for having me, Sally.
I'm so grateful that you have taken some time away from your caretaking of your dad who had a stroke during COVID, during the shutdown. And you were here in lockdown in Chicago, and now you're in Detroit, luckily seeing your dad. Can you give us an update? He does not have COVID. He had a stroke, correct?
He had a stroke,
right.
Correct.
During COVID.
Right. At the beginning, March 24th. So right in the beginning. So, it was rough because, of course, nobody could go into the hospitals. My mother found out right away that she couldn't ride in the ambulance. So then they were like, she was going to drive. So she did drive to the hospital and they told her, no, ma'am, you can't come in.
Right.
But so he had no visitors at the hospital, no visitors at the rehab.
And he couldn't speak.
And he couldn't speak. So he did, when he finally could talk, we did talk to him on the phone every day. But he, I think that it's amazing. I think people really do need people, and he needed us.
Oh, definitely.
He ended up having 2 hospitalizations and 2 rehab stays where my mother, by the second stay, she could visit via the window.
Oh, goodness.
But that rehab wasn't so smart. They wouldn't even open the window.
Yeah.
So my mother was talking through the glass half the time. It was just ridiculous.
I mean, that's love. My gosh, that is amazing. That's amazing. How long have your parents been married?
They've been married July 28th, 1973. So I think they celebrated
Somebody do that math.
47 years this year.
Wow. Yeah. What a testament. And you have siblings?
I have one sister.
Right.
Yeah. Mm-hmm.
Okay.
Yep.
Okay. So Arnold, your dad, is on his way back to himself to drive you crazy, right?
God willing. He is at his, look, let's say this is his last rehab, and they're doing an amazing job, and they really work him hard. And so I'm really, really prayerful that we will be able to get him back to where he's used to being.
So that gives me a good introduction to my question, my standard question. How is love speaking to you today?
I think love speaks to me today because I am not by myself in my apartment. I'm a single woman still. So being in my apartment for 14 weeks by myself was really eye-opening. I didn't think I'd survive, but I did.
Right.
But being able to be, even though it's just me and my mom at the house, being able to be at home with my mom is cool. And then being able to see my dad every day is great. So
yeah. I can't even imagine what that would have been like to be alone for 14 weeks. I can't even I mean, it's just, you got to be staring at the walls like, what is going on? I mean, you can have phone calls and FaceTimes, and I'm sure you were doing all of that, but it really, I mean, what at the worst, what were you feeling?
No, I did pretty good, I must say. And I think it's because of the fact, one, I was extremely busy.
Yes.
So between me and my clients, there were some days I did 4 live streams a day.
Wow.
And none of them were for my brand. They were all for other people.
Right, right.
So I was up to like 10 live streams a week. It was really crazy.
You were sought after.
Right. So I think that kept me busy and kept my mind. Plus, because of the fact I was so frustrated because I couldn't do anything with my dad. I couldn't, all my friends. You needed
distraction.
I definitely needed distractions because I couldn't find even any friends that worked in these different facilities to help me to get the inside and, treat him a little bit better because I really don't think, I hate to say, you talked about healthcare inequities. Right. I really believe that there are some steps in here that, because my dad was a Black man and because we weren't able to be, boots on the ground right there, he was treated a different way than he should have been treated.
Right, right. Well, they
lost his clothes.
Oh, I remember you told me that when we talked. Oh my gosh. They just lost his clothes.
Lost his clothes. And wait a minute. Not only did you lose his clothes, when he had to be transferred to the rehab, I mean, what dignity? The man is in a gown and, getting in the car.
Oh, that's just not nice. That is not nice. Well, oh my goodness. So you are an MD, you went to medical school, but you don't practice. And instead you are committed to helping people live their best life, the life they deserve. Yes. I know you love Oprah.
I do.
And tell us, and you have your talk show, Ask Dr. Renee, which is so awesome. But tell us about why you decided to use your medical degree that way.
So, you would remember Dr. Nancy Snyderman used to be the medical correspondent on Good Morning America.
Yes.
And that's who I used to grow up watching. And I always said from 5, I wanted to be a doctor. But when I saw her, I said, that's what I want to be. I want to be like her.
Are you sure it wasn't Today? Was it GMA?
No.
Oh, it was
she
GMA?
Started out on GMA.
Oh, okay.
And then Today when I was an adult.
Okay. Yes. Okay. Got it.
So I was like, I want to be like her.
Right.
And, my mom's like, we don't know anyone in TV. And she's like, so I think you might want to just stick to the doctor thing.
Right.
But, I stuck with that. And in the back of my mind was like, if I can do it, I really want to try and do it.
So cool.
And here I am. And actually, you also forgot, I have a show. It's in 45,000 doctors' offices across the country called Out of Office with Dr. Renee. And it's also in Walgreens clinics. So
Right.
Yeah.
So when are you in production for that?
So that actually does get produced in Chicago. And of course, COVID's happened. So we haven't really been doing anything. So,
Right. Wow. Well, let's talk about the 2 pandemics going on and the fact that, 1 in 3 Black Americans knows someone who has died of COVID-19. I will say this. I had a friend, an activist, Africa Porter, on the podcast that was in September. And she just, in conversation, it wasn't a question I asked her, she mentioned that she had lost 86 people to COVID. Right. And I went, wait, what? And in that moment, we all know, we know the math, we've read the facts. We understand that the systemic racism is causing the death rates to be higher in the Black community. But when she said 86, and I said, well, I know 2, but I really don't know them. They are the parents of friends of mine. Sadly, they were lost, but I don't actually know them, but I know of them. So those were the 2 deaths that I know that were COVID related, that were close to me. And when I was texting with Africa this morning about a question that I had for her, she was at a funeral. So she's at this moment, 87 people lost to COVID. People that she knows, that she works with, that are, cousins, friends, like coworkers, whatever. It's not just, people that she knows, people that know people. So where, we understand systemic racism, but can you talk a little bit about how this is affecting the Black community, this pandemic, along with the other pandemic? Right.
So at the very beginning of this, unfortunately, it was spreading like wildfire. Black people can't get this.
Really?
Oh,
Never
yes,
heard that.
Oh, no, it was rampant. I mean, several of me and my friends were like, did your cousin, your grandmother, your aunt, did they send you a text message saying, as a matter of fact, my dad even said that one of the people he knew said that to him, and he called me cracking up to tell me.
Wow.
So that was the problem first, is because for some reason we thought we couldn't get it. Well, then once we started seeing these numbers, like, in our lovely city of Chicago,
right.
The numbers were ridiculous for Black people compared to everyone else. And we are not the largest population there. So
right.
It didn't make sense. Then it was like,
that's the thing. The numbers, it's not it's so imbalanced because the population doesn't warrant the fact that
I think we're 30% of Chicago, and the numbers were like 70% in like April.
Right.
Yeah.
Right.
So I think that, once we figured out, okay, so we need to pay attention. So the biggest three are the underlying conditions. Well, then that became a problem. And I think, your friend Oprah even talked about how people didn't understand what underlying conditions meant.
Right.
So we had to go there and explain. Underlying conditions are something because I know a lady, I didn't meet her physically. I met her via online. She had COVID, and she went to the hospital, and they said, ma'am, do you have any underlying conditions? She said no. Well, then they start going through her drug history, and she's taking blood pressure meds, and they said, you have hypertension. She said, yeah. She didn't know that was an underlying condition.
Right.
So therein lies part of the problem.
Right.
But so diabetes, hypertension, and obesity were like the big three flags that were affecting the Black community. These are things that have affected us for a long time.
And asthma, which you have.
And asthma, yes. And so, there's, like I said, diabetes has a whole list of things that go with that. If you have diabetes, and you probably have kidney problems, and you know what I mean? So you have a whole lot of underlying conditions. So that was the problem. And then you also have the problem with, unfortunately, a lot of times in Black communities, people don't have a primary care doctor.
Right.
So as soon as this hit and people figured out, oh my God, this is serious. Well, now they're too scared to go to the hospital, but then they don't have a primary care doctor to do a virtual visit with to see if they actually need to go in.
Right.
Or, they don't know.
So this is where the systemic stuff starts
exactly.
Unraveling. And many people in the Black community and the Latino community are essential workers. Therefore, they don't have the ability to work from home.
Can't take off, can't stay at home, can't social distance. They must be out there every day. They don't have the luxury of, because, a lot of my doctor friends, they literally just camp themselves up in hotels or in rooms in the hospital rather than going home to take it home to their families because they knew they had been exposed all day.
Right.
Well, the bus driver does not have that.
No.
They don't have the funds to pay the, Ritz-Carlton to put them up for whatever amount of days.
Right.
So that is where another issue came in, is because these were the people that were going to work. There was early on, there was a man from Detroit, a bus driver, that his video went viral. He said that he was having a rough time out there. People weren't wearing their masks and stuff. And do you know he died? Of COVID.
Oh, that makes me so sad. I mean, you stand with science. I mean, you are a doctor. You stand with science and speak to the people. And I do like a whole comedy set on it. And one day, if I'm brave enough, I'll put it out there. But I have recorded it. I've put it on YouTube. But I want to do it so much because. But it's really silly. But the truth is it's my PSA for wear an effing mask.
Right.
Because it's the least you could do for others. And so tell us, to anyone listening who would be that person or who knows a person who refuses to wear a mask. Why? Tell them why they should be wearing a mask, obviously.
You should wear a mask not only to protect others, but protect yourself.
Yeah.
Those respiratory droplets can easily land on your nose, in your nose, in your mouth. So why not wear a mask so you don't have to worry about it?
Yeah. Well, there are people that just
wear
think
it correctly too.
Oh, please.
Because I was somewhere yesterday and the girl had her mask under her nose and I'm like,
Nope. Well, I was in Walgreens. I was in Walgreens a week ago, and a young boy, probably 19, was in front of me, and he was buying something. And he did not have a mask on, and he kept putting his T-shirt over his nose, and it kept falling, and T-shirt on his nose kept falling. And I'm thinking to myself, I had COVID. I am still struggling with so many aftershocks. It's like a freaking earthquake, and the aftershocks don't go away for some people because I do have a pre-existing condition. And so I started talking. Renee, I swear to God, I didn't even know I was talking. I was like, am I talking? Am I speaking? And I was like, sir, you really need to wear a mask. There are people out there dying of this virus, and you cannot be in the store if you don't have a mask on. And I'm like, oh, great. This is probably like being videoed by the, by the in-store thing. But I was just like, listen, you can't disrespect others. I had COVID. I barely survived it. I was really struggling. And I mean, I can't say I barely survived it. That's a little dramatic. I had a hard time surviving it. It was hard, and it's still hard. And so he never looked at me. He never spoke to me. He did his thing and he left. And when I got up to my turn to ring my stuff, I looked at the cashier, who was an older woman, and I said, you should have told him no. You should not have allowed yourself to be in front of him. Your life is worth too much. You should have called your manager and told him, please come back with a mask. And I don't understand why anyone wouldn't say that.
Right. And so I'll tell you, we went to the cider mill. It's a big thing that we do here in Michigan this time of the year.
Mm-hmm.
And we didn't know how it was going to work out because this cider mill is not one of the bigger ones. But they had everything outside. They had the little things on the ground, and you had to stand 6 feet away. But they had somebody who literally was watching every single person come in. What do you need? You need to go here. You need to go there. And guess what? He literally came and tapped 2 people on the shoulder and said, you must have masks on if you're going to be purchasing today.
Right. I mean, it's just common sense.
Right.
So what's like,
and you don't have to wear and that's the thing. Somebody interviewed me for an article for Medium. You don't have to wear a surgical mask. You can wear a cotton mask.
Right.
I prefer a cotton mask with a filter. You can, whatever makes you comfortable that you will keep on your face and not touch, because him in that shirt, you and I both know he was spreading all sorts of germs everywhere because you didn't just leave it alone. Once the mask is on, just don't touch it. Leave it alone.
Right.
And so you can wear whatever. Now, what the worst thing though is those bandanas. I hate to say, but they are allowing a lot of things to come through them. So just be cognizant of that. But there are a lot of options out there. And yes, if you wear a face shield, you still need to wear a mask because things are passing under the face shield, everyone. In case you didn't realize, the bottom is open.
Yeah. True. So the face shield and the mask are the key.
Yes.
Like that's when you're really.
If I have to fly, which I may have to.
Yes.
I will probably wear. I'll make sure I wear my glasses. If I don't wear glasses, I would have a face shield on and my mask.
Right. And so I recently drove my husband and I drove my mom to New Jersey. We were visiting her. We stay at an Airbnb, and luckily, because it was summertime, we were able to see her outside on her porch. But we did drive her, and I was really kind of freaked out about it. So my husband and I and my mom wore a mask, wore the shield, wore glasses, and kept the windows open. So that's the least you can do. But I don't know. It just doesn't make sense to me why anyone wouldn't.
It makes no sense when people say that they can't wear a mask for 2-3 hours or even 15 minutes when surgeons wear masks for 12 hours surgeries.
Exactly. And it's not forever, right? We are going to get through this one day.
We will.
It is the one thing that we can all do to respect others and to just show that that you are also supportive of this pandemic going away, because it's not going to go away if you don't wear a mask right now. So we got to get that out there. I like to say that my team of doctors, which is my pulmonologist, my rheumatologist, my internist, have all told me that I'm no longer a candidate for wine. And so I have been sober for a long time through COVID, post-COVID, because of all the inflammatory issues in my body. So I say to people, if you, God forbid, got COVID and you had inflammatory problems and blah, 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 and you all of a sudden couldn't drink wine, maybe you'd consider wearing that mask. So I say, consider your next cocktail and then you'll wear
especially the moms
mask.
that have the virtual school now.
Yeah. Those moms need that. We all need the wine if we're working like that. God bless the moms and dads who are pulling their own work and having homeschooling kids. It's overwhelming. It's a lot. So what is one of the first things people can do besides wearing a mask if they're struggling with their health in this pandemic? Like if they already have, like for me, I have an autoimmune disease. What is the best thing we should be doing? Are there supplements we should be taking?
Well, I say make certain that you have all your prescriptions.
Yes.
And make certain that you are talking to your doctor, because now is not the time to get sick.
Exactly.
Like I said, my dad, this is the worst time to have a stroke.
Exactly. Couldn't he have not scheduled that the right way?
Right. But this is not the time to get sick. Like you said, I am a severe asthmatic.
Right.
So I'm making sure that my asthma is perfectly fine because I'm not trying to get sick. So that means avoiding my triggers. So whatever it is for you, make sure you do that. And of course, vitamin C, people are really big on because, that helps to eliminate different things. And vitamin D, because we all were not being able to get out, was very important to take vitamin D. And you can talk to your physician, but really vitamin D is one of those things a lot of people lack, especially those of us who live in the Midwest and northern parts of the country. Yep. We don't have the same sunlight as, my favorite island, Antigua, but we have sunlight, but it just isn't the same. My vitamin D levels were low a couple of years ago, and I walked 6 to 10 miles a day and did it that entire summer in Chicago.
Wow.
But my vitamin D levels were low.
Yeah.
The sun is not the same. So vitamin D is something people should take.
What about zinc?
Zinc is another good one. And you know what I was going to say? Fruits and vegetables. Eat properly. And I know that COVID has really made a lot of us eat poorly because we were just eating our feelings.
I gained 15 pounds.
Right. And I would never say how, so.
I've lost 11 at this count.
I'm on the losing end myself. So yeah, I understand that, but try and eat properly because food is medicine. And if you eat your vegetables and your fruits and not killing it with, the red meat and because I'm not a vegetarian, nor a vegan. So I believe in eating meat. Right. I'm not saying that, but just make sure that you eat a balanced diet so you can remain healthy. And you know what also affects your immune system? Stress. So please do not watch every update.
Oh God, please.
Because they'll make you crazy.
Don't even watch television.
Right. I mean, it'll make you insane.
Right.
And you don't need that stress. That stress causes disease also.
Right.
And lowers your immune system. So you want to make sure that if you need to see a therapist, because all these things, cortisol is a serious, steroid that comes into your body when you're stressed.
Right.
You don't want to get sick. This, like I said, not the time to get sick. But if you do get sick, please make sure that you talk to a doctor and go to the emergency room. They've got it under control now in most states where you should be fine. You won't get COVID by going to the ER. Right.
And also it's not the time to twist your ankle or break your thumb or anything like that. So
don't do anything fancy.
Yeah. Don't climb a ladder to try to fix something. Let it sit for a while if you don't want to hire someone to come into your house. I mean, it's really not the time to distract what the main thing that's going on in these hospitals. And you don't want to just open yourself up to it. Plus you want to stay ahead of, like you said, of whatever it is that you suffer from. So if you have asthma, you want to take care of your lungs. That's for sure. I mean, we thought it was a pulmonary disease,
but it's affecting so many things.
Yes. It's the vessels on our, so can you tell us a little bit about that?
Well, I don't know much about that, but I will tell you,
Okay.
I recently did interview an ophthalmologist, and he talked about, how there is presentation of COVID in the eyes, which is why I was telling you, make sure that if you do fly, you cover your eyes. So you want to have a face shield on, or you want to wear glasses. And that's why we also kept saying, don't touch your face.
Right. Don't touch your face.
So if it is on your hands, you rubbing your eyes, you're going to put it in your eyes, just as you would put it in your nose or in your mouth. So
right.
Don't, there's mucus secretions there, just like in your nose and your mouth, and all these respiratory droplets can land in there. So please just don't cover your eyes too, because you just don't want to get sick.
Right. And I've asked my own doctor, and nobody has an answer for me. So I'm not looking for the answer, but I will say that like I was talking about these aftershocks of COVID for me.
Right.
I have an inflammatory psoriatic arthritis and psoriasis disease. Mm-hmm. And so my gums are swollen and bleeding.
Oh, no.
I have fever blisters on my lips, which I've never had before. My eyes are constantly just tearing, crying. I have pleurisy in my lungs. So it doesn't go away quickly. I mean, I'm 58. I have, like I said, an autoimmune disease. So maybe that's part of it. So I am immune suppressed. But if you are lucky enough to survive this awful virus, you still have things that could continue.
Yeah, I heard some people having trouble with their inhale, like they can't inhale as deeply as they did before.
Yes, that's true. And so if I have an internist, I can message her. She'll get back to me. But if you don't have health care, and you are in a community where you are living with more than a few people, the system's against you. How are you going to survive? And so what can we do this is a very large question. What are some solutions that people can do who find themselves that they are essential workers, or they are living with more than a few people, or they don't have health care? I mean, it's such a scary time.
You got to wash your hands.
Yes.
And when you come home, if at all possible, try and remove your clothing as soon as possible.
Very important.
Throw it in the washer or throw it into a bag, and then go expose yourself to the family, because at least if it's on your clothing, you've taken it off, and immediately go take a shower as soon as you get home from work. So wash your hands, get rid of your clothes, and take a shower. Right. And those are things that I know. I have physician friends that have been doing this. I know essential workers from grocery stores, bus drivers that have been doing this, and this has been working. So if you can, try to do that.
Right. Okay. So it's just COVID can't see color, and yet it is seeing it quite clearly.
And then the other problem was the testing. Testing was only certain people could seem to get tested, and there was not availability. Now that should not be a problem. I think everyone can get a COVID test. It should be free. So I don't think that's a problem anymore, but that was a problem early on, and we knew that was a problem, and that was part of it, was that people didn't know they had it. So then they didn't know they were spreading it.
Exactly. So you're a brand ambassador, you're an influencer, you're a talk show host, you're out of office with Renee is in 45,000 offices across the country, right?
Yep.
For doctors' offices. You have your own health stuff that you need to watch and take care of. So when do you sleep?
So I am real anal about getting 7 hours sleep a night.
Good for you.
I have my Fitbit, and I literally check it. And thankfully, because of my schedule, if I wake up and see I don't have it, then I can go back to sleep, wake back up later.
That's awesome. But
yeah, I'm real big on 7 hours sleep.
You get your sleep. Okay.
Yep.
And speaking of Fitbit, how many steps do you get in a day, or how many steps? Okay, you don't have to tell us what you get, or if you want to, you can. But how many steps should everyone be getting a day?
So to maintain 10,000 steps a day. But once you want to start losing weight, you need to up that. So I get 12,000 a day.
So can 12,000 really make the difference as opposed to 10?
Let me tell you that when I lost 60 pounds, I hate gyms, hate
Right.
them with a passion.
Right.
So what I did was walk the city of Chicago, and all I did was 10,000 steps a day was my goal.
Right.
Now, I usually most days got more than that, but that was my goal every day. So you really can walk off the weight.
Well, okay. So that's interesting you say that, because I've been a runner since not long distance, but I always go out for a run. That's my quick hit since I was a kid. And so I could barely. The weird thing is, though, I did go for a run the morning that I got the evening I got the fever and I knew it was COVID. I had gone on a run that morning. And the reason why I went on a run was because I wanted to prove to myself I didn't have COVID, because I started feeling like that heaviness in my chest a week prior. And I was like, is this anxiety? Is it COVID? I don't know. And then, of course, when the fever and sore throat came, I was like, oh, I have COVID. But anyway, now that, okay, so that was March 30th. Of course, the results came back positive. I isolated. I wouldn't say that I felt like I could even go out for a walk until June. And so I don't run anymore because I don't have the breath for it.
But you know what? You're just not running right now. You may be able to run again.
I may never run again, and I'm okay with it, because I have discovered walking. And I always thought that walking was like, not really anything, but it really is. Mm-hmm. And it's really helped me lose some weight that I needed to lose for my health. And so, but I like what you said, because sometimes when I'm at 10,000 steps, I feel like I haven't done enough. But 12,000, but I can't do 20 every day. There's no way. That's like, 20 is like when I was at the Oprah show running around and seating the audience. But like 12, I want to make 12 my new goal. So 12 can really take you up that level. Is that what you're saying?
Definitely.
Okay.
Definitely.
Well, that's not that hard. I don't know if anyone listening or if you, Renee, have ever done this, but like, I have an Apple Watch, and I have the Apple Watch for two reasons. One, so I can find my phone because it pings it. And two, so that I can see if I've completed the circles of my steps, my calories, and my standing. And so I sometimes, if I'm like 4 calories away or 4 steps away or 2 minutes of standing away from completing all 3 circles, I will just keep walking in my bedroom before I get into bed. I'm like, why?
Oh, I ran next to my bed the other night. I needed another 800 steps, and I go, oh boy, you gonna get this. And
exactly.
I literally ran in place.
I feel like it's a Saturday Night Live skit. I think that's really funny. So I'm not alone. So there's others of us doing that. But 800, that's a commitment. That's a bit longer than 80. That's really funny. So what's exciting you right now? Are you working on any new projects or anything?
So I have now decided that I want to become a bonds trader and an options trader.
Oh my gosh.
So the bonds class was videos that I could watch at my leisure. So I've done that. I'm just waiting. The platform we use to trade the bonds is only available on Windows 10. And of course, I'm an Apple girl.
Right.
So I'm waiting for my PC to come.
Right.
And then I will be bonds trading for real. And then the options trading, that's a class that I just started. So I'm very excited. By the time this airs, I will have made thousands of dollars options trading and bonds trading.
I love that. So you are supplementing, you are side hustling what your purpose is, which is to make people's lives better by using your medical degree in conversations that you have on Zoom, on Facebook, in doctors' offices, being the Dr. Nancy Snyderman that you are. That is super cool. Well, wow. So you are math-minded, I guess, as a doctor?
So I was. As a matter of fact, my original major was chemical engineering, because I actually went through an engineering program from the time I was in the 6th grade all the way through high school. And so math and science was my thing.
Yeah. Well, that makes sense.
And I will tell you, honestly, bonds trading, not much math involved, maybe some short adding and subtracting, but really it's a lot of other things. I don't know. It's very interesting. And he was saying, there's a guy that took the class is 13. I shouldn't say guy, he's a boy.
Wow.
13.
Wow. Wow.
And there's a 17-year-old that's like killing it.
Of course.
Yeah, killing it. So, it's not even, I wouldn't even say it's math and science. It's just, this is something I never thought of. And then I was introduced and was like, oh, well, let me, pay attention. And this might be a couple hours a day, make a couple thousand. And, I can have the rest of my time. I do a lot of volunteer work. I'm very active with the Girl Scouts.
I know, that's where we saw each other.
Exactly.
Right.
So, so I'm still doing that. And so this will give me time to do other things, because I'll have this income coming in.
Right.
And then, my biggest news is I am now an official YouTuber.
Oh, so right.
I am now monetized. And
so tell us how that happens.
So they have 2 requirements. You have to have 1,000 subscribers and you have to get 4,000 viewing hours within 365 days.
Okay.
So at the top of COVID, like I said, I was very busy.
Right.
And all these people were calling. So I just started posting a lot more videos to my YouTube channel. And I started at 400 viewing hours, I think, at the beginning of COVID.
Yes.
And we got to 4,000.
Wow. That is awesome. And how many subscribers do you have now?
1,800, I think.
Awesome.
Something like that. Yeah.
That's awesome. Well, you're using your platform, and that is so the purpose of this podcast. It is for those of us to use the platform that we have, whatever it may be, to make the world a better place. And that is exactly what you're doing. You are fully in your purpose. What reminds you that you're in your purpose? Like, is there, like for me, the smell of Oprah's hairspray and flat iron when I would walk up the marble staircase at 6:30 in the morning at Harpo, and I'd be like, show day. That smell reminds me of my purpose. Of course, I don't smell it now, but if I'm at a hair salon, I smell it. I'm like, oh yeah, show day. And for me, show day is whenever. It don't have to be in a studio. But what reminds you of your purpose of putting good out into the world?
I think when people comment on stuff that I've posted, as far as, these different videos or these live streams, or I get, as a matter of fact, somebody sent me this week a text message of me in the doctor's office explaining something about, I think it was heart disease or something. So any feedback I get, because I tell everyone all the columns that I did right, I say I pretended to be a writer because I really don't like writing.
Yeah.
But once I finished and they were out there and all these thousands of people saw them, I had a couple of columns that went viral. Once they were done and I got people's comments and they were saying, you explained that better than I ever understood it. Or my doctor didn't have time to explain it. Now I understand. Now I can go ask my doctor this or something. Then I'm like, oh, okay, well then this is not a waste of my time. And actually my channel, we are now about to focus on asthma.
Yes, which is clearly in your heart.
So I'm really excited to get focused on that and to help parents, especially with children, and then help the children to understand too how to manage their asthma, because I think people play with asthma and you should never play with your breathing. No,
never, ever. I have 2 kids of my 3 have asthma, and they were the ones that I was scared most of with COVID. And interestingly enough, they're the 2 that didn't get it. So my husband got it. He was asymptomatic. My middle daughter got it. She got the COVID toes and all of the same things that I had, but not as horrible, but she was not well. She tested negative, but I know she was positive because she had every symptom. My son tested negative. He had a fever for a few days. So he may have had it, but my son and my other daughter, they have asthma, and we were really freaked out, and we were trying to keep away from them as much as possible. So how, as we go towards this vaccine, right? Like, oh my gosh, like maybe even if it's true, by the time this airs, we will have a vaccine.
We'll have one. Yeah.
Let's hope, right? What does that look like? I mean, how can you, what are we talking? Who will get it first? Will there be other strains?
I don't know. I don't know how they'll roll it out, but I think it's going to be just like flu, whereas every season they will try to get a vaccine for the one that is the strain that's out there then. Right. Because that the flu vaccine that you get this month is not the same one you got last year.
Right.
They try to tackle the one that is the most prevalent. So I think that's what it's probably going to be for COVID. I personally think we'll have a treatment by the end of the year, but we will have a vaccine by the spring.
Yes. Yes. And when you say treatment, what do you mean treatment?
Like they'll figure out, okay, well, we need to do this for this. And that, it won't be guessing and trying to figure out. And, because really right now, I think a lot of it is treating the symptoms that the people are having.
Right.
Whereas we will have, just like there's, it just left my brain, but there is actual treatment for flu. If you have the flu and you go to the doctor, they give you something.
Yes. Okay.
Right. So that's what I'm saying.
Tamiflu.
They'll have Tamiflu. Thank you.
Mm-hmm.
They'll have something, I think, to be able to treat it.
Mm-hmm.
Not to mention also, and I know the antibodies is a treatment that has been working. If you are someone that has had COVID and you have the antibodies, you can donate them.
Right.
They actually even have TV PSAs about it now. I'm really excited because they need to get that word out.
Yeah.
Because a lot of people have had a shorter length of sickness because they receive these antibodies.
Okay, so because that's what Tamiflu does. It reduces the length of time you have the flu.
Yes.
It doesn't cure you of the flu.
Right.
So I'm so glad you brought this up because I have a personal question. I have been tested for the antibodies 3 times, thrice. Okay, 3 times negative. I don't understand why I don't have the antibodies when I was so sick. And I was so positive and I had it. And none of my doctors really get it. Like, are there false negatives?
I'm with them.
I just want to give my blood. I want to be able to help someone.
I think that maybe the antibodies don't stay as long as other people. And so maybe when you were sick as a dog, they were there and they're gone now.
Right.
But, so I think that might be the case with some people, but I don't know.
And I also want to ask you, is there anything to do with blood type and who gets COVID?
So I have heard that too, but I've not heard it proven.
Right.
But I've heard people say that, but I haven't heard that it was researched. And not to mention though, because this is so new, anything researched doesn't have a whole lot of, people in the study.
And it changed. So there's no one to study. And it changes.
It could come out next year. It could come out next year and they say, oh, if you're O positive, this. But right now we don't have enough information for us to say definitely that is the case. And, just like they tried to say it was just old people.
Right.
Not the case, because look at now, all of these young people.
Right. I know. That was like the thing.
30-somethings, the college kids,
Right.
Yeah.
The college kids. It's the whole college thing. And it breaks my heart from the nursery school kids who are being taught nursery school online, which makes no sense, to the college kids who are supposed to have the time of their life and can't. So it's
But I keep reminding everybody,
what?
I don't think it'll be the whole school year.
You don't?
I think if we would please just abide by these rules,
wear a mask
for this semester.
Yeah.
I think that by January we could be back into the dorms and
even with it being winter and not being able to be outside.
I still think that because I think they'll have a treatment.
Okay.
So then they'll know, they'll be, if someone comes in, but I think I think also the herd immunity, we might be able to, because, there are people that are receiving vaccines now that are testing it out for us.
Right.
If we can get these numbers where they need to be, I really don't think it's going to be all school year.
Okay.
I really think it'll be.
Well, there's a little bit of hope from Dr. Renee. I'm feeling good.
I'm positive, Patty, though.
You
I
are.
always have a positive outlook, and I'm just very prayerful. But I have to look at other countries that wiped this out. So before it came, they got rid of it.
Right.
And I'm like, what is different? The difference is we don't listen.
We
are so accustomed to having all these freedoms that we feel like our freedom's being taken away because we're being asked to wash our hands or to wear a mask.
Right.
No, it's not.
Right. You said it perfectly. It is exactly right. We don't listen. And let's start listening so that we can get this period of time behind us and move forward and do all the things we want to do, which is love each other and hug each other and and go to a dinner party. I mean, God. And just not be in the hospital. If you're enjoying this podcast, I would love it if you would consider rating it 5 stars. You notice that there aren't commercials, right? That's because I don't have a sponsor. Not yet, anyway. So listen to the Love Speaks series commercial-free and rate it 5 stars. Send it to your friends. Share it. Spread the love. And thank you for listening. Do you have a daily prayer? You said you're prayerful. Do you have a daily prayer?
I do. One of my girlfriends wrote me this prayer, and she wrote it, I think, in 2017. And I literally say it before I put my feet on the ground and before I get in the bed at night.
Can you share it with us?
Lord, I knew you were going to say that. Look, let me see. Because I say it so fast to myself that I'm like, let me see if it's on. Let me see if I can read the notes.
While you're scrolling, I will just say, my prayer I have a very specific prayer, and it could last 20 minutes if I do the whole thing, which is sometimes too long for me. But my short and sweet prayer, which I've shared before on my podcast, is thank you, God, for all of it, especially this part of it. So if this part of it is really hard, like COVID or anything that is difficult, troubles from, whatever you're struggling with, you always find the good and the lesson and the beauty and the joy. And so that's why I like to just say gratitude for all of it, meaning the good, the bad, the ugly. Did you find it?
Okay. So ask and it will be given to you. Seek and you will find. Knock and it will be open to you. If God promised it, he's going to stand by his promise. Through faith and patience, we inherit God's promises. This is where patience comes in. This is where perseverance comes in. This is where trust comes in. Just because we don't see things happen right now doesn't mean we should quit. Keep believing, keep hoping, keep enduring, and keep praying. Our God is always faithful to his word.
I love that. Wow, yes. That's beautiful. You said that real fast, though.
Jabez. Oh, I'm sorry. I do the prayer of Jabez in the morning when I get up.
And what is that? I don't know what that is. I mean, you don't have to repeat it, but what is it? Who's Jabez?
It's in the Bible.
See, God help me. I'm a confirmation mentor this year in my church for 7th grade girls. I have got to learn more about the Bible. Okay.
Well, I'm going to tell you, my friend has a devotional for tween girls or something. It's for girls.
Yeah.
I have to send you that.
Please do.
It's on Amazon.
Okay. I need that. Definitely.
But the prayer of Jabez talks about asking for more things. Give me increase and make sure you help me to avoid things that are bad for me. And basically, that's what it is in a nutshell. It's a little short book, though. The book might have 30 pages. I don't think it has that many. Might be 15.
I like that.
And it's a small book.
I like that. I love small books. I'm reading right now The Game of Life and How to Play It. And it is a very small, tiny little book that was written a long time ago that keeps being republished, and I'm really enjoying it. Did you ever have a no that came to your life that really launched you? Like someone said no and you just did it anyway?
So you'd be amazed how many times I was told I would never be a doctor. And it was just several times. These were people, and this is why I related to becoming a Michelle Obama. She was that part in her book where she said the counselor told her, well, I don't think you should apply there.
Right.
That was me. I had school teachers tell me, counselors. There was a counselor at my college that told me I wasn't college material.
Wow.
Because I had a rough time with one class.
Yes. So there you go.
And so my thing is, I always say, well, I'm going to show you.
Yeah.
So, and one of my friends, may she rest in peace, she said, Renee, you are the one person, if someone says no or closes the door on you, you'll find the window and you'll show up standing in the same room as them. And they'll be like, how the hell did she get here?
Yeah, I agree. that would be your way. You slide in like a bat. You come in under the windowsill in the rafter, and there you are. I love that. Well, you know what? You do show up. You are some. Listen, you're just your Oprah story. Is like I am not going to let this moment go past. Can you tell people who I know it? I know it very well, but tell us your Oprah moment.
So I go to the Oprah show my first time with my parents and one of my friends, and Sally Lou, of course, welcomes us in, and she tells us, when you see it say Oprah After Show, stand up if you want to speak to Oprah. And of course, my sister and I have rehearsed what I was going to say because I didn't know you were going to say that. But I knew somehow I was going to get an opportunity,
right?
And I was going, because my goal was, I'm going to speak to Oprah. She's going to listen. I literally said this, and I said I'm going to take a picture with her. And everyone's like, you can't ask her for pictures. I go, please don't worry about what I'm going to do. I really am not asking.
You're
for
getting in the room.
From you.
You're getting in the room.
I'll be fine. And so it's funny. I don't know if I told you when she came out. This is when she would come through the audience to the door.
Yes.
We were sitting I think only maybe 6 rows from and we were exactly close to that aisle.
Right. And
my mother goes, she looks at me because everyone, is told to stand up and applaud. My mother stares at me and is like, Renee, are you okay? I literally froze. I'm like, Mommy, she's in the room.
She's in the room.
Like, I know, Renee.
Right.
I just froze. But yeah, so just like Sally Lou said, the
That's
camera,
me.
The background changed.
You're talking about me like I'm somebody else.
I stood up and I stood there and my dad whispers to me, Renee, you're blocking the view of the lady behind you. And I was like, I wanted to say something, but I knew cameras were on. So my mother says to him, didn't you hear the lady? The lady told her if she wants to speak to Oprah, she has to stand up. And sure enough, there was one person before me and Oprah said, yes, ma'am. And my rehearsed spiel, I said to her, and sure enough, she said, come on down. And I couldn't believe she said, come down. And I sat next to her and she had this death grip on my hand.
Right.
And I sat there and it's funny because I was having a whole internal conversation. But if you watch the video, we actually were conversing. And I was like,
right.
My mother was like, and so when I got back to my seat, my dad goes, you did it. I go, I did, didn't I?
Wow. Of course you did it. You were never not going to do it. I love it.
Funny
and
thing,
I love
when
your
we got
clip.
home, we talked to my sister, and my sister, she had already talked to my parents. She goes, I heard. I'm like, Alicia, what's wrong? You met Oprah. Alicia, you knew that's what I was going to do. I invited you to come to the show. You said you had to work.
She did. She said she had to work. Did Alicia ever get to the show?
Yes, she did.
Thank
As a matter
God.
of fact, it was the show. This probably happened a lot of times for you guys, but somebody collapsed and there was a snowstorm brewing outside.
For sure.
They had to completely clear the whole audience out. And we had to have the ambulance come in.
Yep.
And then they put us all back together and we still had a show.
Yep. We had literally, when I tell you, we had seizures, we had water break, we had miscarriages, we had babies born, we had heart attacks. And I will tell you this, doctor, that my dad, who was a doctor, who saved lives, when I used to visit him, when I would go with him to the hospital on the weekends. I write about this in my book. I just was like, I felt like I was traveling with a rock star because everyone knew him. He knew everyone. He was always stopping to say hello to everyone. He was like Oprah, right? And so I just knew that I was not doctor material. I wasn't like you. If someone had told me I couldn't be a doctor, I'd be like, yep, you're right about that. But I knew that I wanted to impact people's lives and make their lives better, like my dad was. But I wasn't going to save lives. But let me tell you something. That is why I worked for Oprah. That is totally what happened for me. Like, that's what led me to work for her, because I wanted to make other people's lives better, but in my own way. But when that would happen at the show and someone would get sick and some emergency happened or an asthma attack happened or whatever, someone fell or whatever it was immediate for me that I was holding that person in my lap with them until that ambulance came, because it was like it was just innate in me. It was like I was my dad's daughter. I was like I was going to be there to care for them. And I'll never forget, we actually had a woman who was waiting outside on the standby line with her daughter, and she had a heart attack and died. And I watched the whole thing. I saw, like, it was. And all I kept, and I was right there with them, and all I wanted was a blanket. I was like, this woman needs a blanket. Like, she literally passed away on our sidewalk outside. And the ambulance came and all of that, and we did all, of course, the things correctly, but all I wanted was a blanket. And I just remember then we we had blankets because God forbid it happened again. But yeah, that stuff happened all the time. So I'm not surprised you were in an audience when that happened.
Because then my friend was like, Renee, I'm in med school. I am not a doctor. I'm not doing anything.
Yeah. No, I know. The first thing is, is there a doctor? But honestly, if you were to have something happen, it was good that you had it happen there because the ambulances came in 3 seconds, to the Oprah Winfrey show. So that was the good thing. Well, we are almost out of time. So I just want to say this, that, the numbers keep changing. This podcast is being recorded and won't be aired until later. So things will change. But the fact that Black Americans continue to experience the highest COVID-19 mortality rates nationwide, like more than twice as high as the rate for whites and Asians and who have the lowest rates. What I think is so sad when we think about it is if Black Americans died of COVID at the same actual rate as white Americans, that there might be 20,000 people that survived. And that's approximating. And that's just like, think about that number, 20,000 people. It's unfair. It's, it's just another, it's like you said, like we said earlier, it's just another pandemic on top of a pandemic on top of a pandemic. And I know we can't solve this overnight, but I'm grateful for some of the things that you were able to offer as a physician, as a Black woman, as a daughter whose dad, luckily, thank God, does not have COVID, but who's surviving a stroke through this time of pandemic when families can't be together, and how his treatment is going. Any final words on speaking to the Black community?
We just need to really wear our masks, wash our hands, and social distance. Please, just no gatherings before Christmas. Like, okay, maybe then. By then, maybe we can have a gathering. But, just please, we've got to social distance. They have proven that it works.
It does.
I know it works because look at the other countries who had very, very strict curfews.
Right.
And they only let you go to the grocery store if your last name was so many letters because they only wanted so many people in the grocery store. Little things like that are what saved a lot of our islands, the West Indian islands that my dad is from. This is what saved them because they were so strict with the social distancing.
Right.
So we know that works. So let's just do it, you guys. Unfortunately, we've had to do it a long time, but that's because no one is paying attention.
Exactly.
I kept telling people in March, if we would hurry up and do this now, we would have a summer.
Right. So,
but no one listened.
Dr. Renee, I'm listening. I thank you. I'm going to put my mask on as soon as I'm off this podcast. I can't thank you enough for your time. I am praying for Arnold. I hope that all goes well up in Detroit for him. And what's your mom's name?
Joyce. Reverend
Joyce. That's right.
Yes, she's a priest.
And I'm sure she's got you all covered. So that's good. Yep. But I thank you for your time. Thank you for your wonderful energy that you put out into the world. I can't wait to see your platform continue to grow and shine and make life better for everyone. So thanks for speaking on this topic today. I really appreciate it. And I can't wait to see you live in action in 2021, and we can have a hug or two.
Yes. Amen.
So thanks for your time. Get back to that hospital and see your dad and say hello. All right. Thanks, Renee. Thanks for speaking love today on the podcast. Thank you.
You're welcome.
See you soon. All right. Thanks.
You too.
Bye. I have loved speaking with you today, and I want to speak with you more. So follow me on all of my social platforms at Live Love Speaks on Instagram, Twitter, and Facebook. And if you want more stories like the stories we speak here on the Love Speaks series podcast, go to lovespeaks.com and pick up a copy of my new book, Speak. Love your story, your audience is waiting. To step up your speaking game and your human game. Check out my blog while you're there.
Sally Lou Loveman is a mom, speaker, author, former audience producer for the Oprah Winfrey Show, and founder of Love Speaks. Each week, Sally Lou and her crew have a conversation about how love speaks in their lives and how it can speak in yours. From kindness to composting, no topic is off limits. If you need a community to kickstart your heart, you need the Love Speaks series.
Thanks for listening. Your Love Speaks.